Hey, welcome back. This is another Doc Talks. This is the commandments for when we're training a lower body, meaning anything below the hips, with a risky low back. Most of the time, deadlifts, squats, these types of things can be kind of painful getting back into it after we've had a risky low back or we've had pain. So these are my commandments. I want you to take a little bit of a lesson here. These things aren't bad later on, but we want to stop some of those things when we're coming back from an injury or we have a potentially risky low back. So first things first, thou shalt not directly load the spine. Directly loading the spine, meaning using a barbell, putting it on the back, anything that's going to be above the waist, it really directly loads the spine. So having something like this and getting into a squat or getting into a deadlift, that is kind of directly loading the spine a little bit. We'll talk a little bit about that deadlift movement in a second. But thou shalt not directly load the spine. Make sure that our placement of the weight is something that's going to be pretty low or at least hip or lower. In addition to that, thou shalt not bilateral stance unless there is no spine load. So that's when we look at hip thrust as one of our main components for training the lower body, especially with a risky low back. So hip thrust. If you've worked with us, you've probably done some hip thrusts. So we usually place our shoulders on the bench, and if we are going to load it, we get to load it at the waist, so it's not going to be directly affecting the lumbar spine. So if we have weight, we put a sandbag here, we put a barbell, and we actually get to still train the lower body without really having the low back potentially risky. So a really good one, a really good option for training the lower body, especially with that risk. Thou shalt not require stabilization against resistance. When we talked about the deadlift, this is, even if the weight is down here, as I go forward, there is a hinge and my body does have to stabilize at this point. I can't stay upright and gravity doesn't really help me. It actually starts to hurt a little bit. So until we have the capabilities or the threshold built back up, we cannot do that. That's one of the commandments. Thou shalt not stabilize against resistance. If we have body weight and we're doing this and we're starting to get back into it, a little bit less risky. But if we have weight in our hand or we're trying to pull something off the ground, that's where we need to kind of step back a little bit. Then we're looking into thou shalt not bounce or require to stabilize against momentum. If we're starting to move quickly or we're throwing something or we're jumping and bouncing, at no point can we just automatically stop. And that's when we have those sudden unguarded movements that hurt our back. So we want to avoid some of those things when we're stepping back into a training program and we have that risky low back, because we don't want to all of a sudden just be in a movement and have that kind of seize up on us and we still have to kind of move to slow down the momentum. Not a good plan. So thou shalt not require stabilization against momentum or bouncing. Number 5, thou shalt not, or those thou shall, this is the first one that we get to, thou shall, is going to be bilaterally carry, and we're going to see if we can get that into a farmer stance. So if we have weights, we're going to keep it down by our hips, and now being very careful, obviously picking up off the ground, having a coach, having someone help you get it into position is very important. But gravity is now not making us pull back or stabilize against any of those positions. Now we get to just let our bodies stack and we can still stress the back. We're still putting some pressures on our stabilizers, but we're not putting ourselves in funky positions. It's a lot easier to stabilize here than it is here. That's one of the first things that I'll have as a patient gets back into loading the spine, is seeing if I can get that into a stacked position so they start to get really, really comfortable. Last one, thou shalt progress slowly back into the sacred stack. Really important that we end up figuring out how to get back to these positions where rib cage and pelvis are directly over the top of each other. But in the case where you have a patient that is splinted like this and they're in pain, we have to be very careful getting back into that. So you have to be guided. You have to have someone that figures out a way and a plan to get you back out of that splinting position as much as you can before you start getting right back into that stack. Super important. But all of these, just know in training, it's good to have some of the other stuff that I said is not on the table. So our squats and our deadlifts, it's really good once we're out of those pain situations or we're not as risky. I'm not trying to demonize any of those movements, but make sure that you hit these commandments if you're trying to get back from back pain. Thanks, guys. See you next week.